Imagine waking up and just feeling this crushing weight of major depressive disorder, MDD, where simple things feel impossible. Joy just isn't there.
It's a tough reality for so many.
And then add to that the constant pull of alcohol use disorder, AUD, that relentless urge, maybe a temporary escape, but it just digs the hole deeper.
Right. And when these two happen together, MDD and AUD, it's not just double trouble. It's like this tangled knot.
A vicious cycle makes life incredibly hard, and honestly, treatment becomes really, really difficult. Traditional ways often just don't cut it.
Exactly. That co-occurrence, it's common, and it really worsens the outlook. Each condition just feeds the other one. It's that bidirectional trap you mentioned. Recovering from one feels almost impossible without tackling the other.
So welcome everyone to Talking Ketamine Podcast. This is episode 27, Ketamine versus Alcohol Use Disorder. Our focus today is, we're going to unpack a really interesting, very well-designed study. It sheds some new light on potential help for people facing this exact dual diagnosis. We'll explore how ketamine performed, and trust me, there are some pretty surprising findings in here. We want to help you, our listener, get informed with the latest research.
Yeah, and the work we're looking at today is from a great team, Yoon, John H. Crystal, and their colleagues. They're based at the VA Connecticut Healthcare System and Yale University School of Medicine.
Okay.
The study title is Antidepressant Efficacy of Ketamine plus Naltrexone in Outpatients with Comorbid MDD and AUD.
Got it. So let's just reinforce the scale here. MDD and AUD, as we've touched on before, they aren't small issues. They are major contributors to disease burden worldwide. We're talking millions affected by each one.
That's right. Huge numbers.
Yeah.
And when they occur together, that comorbidity, it just leads to a tougher prognosis. Someone depressed might drink to cope.
Self-medicate, yeah.
Which then, of course, makes the depression worse, harder to treat. Or the despair from AUD can trigger or worsen depression.
Yeah.
It just goes round and round.
And that's the wall traditional treatments often hit, right? Standard antidepressants, maybe therapy, they just don't seem to work as well when AUD is in the picture. The brain chemistry is just complicated.
It is. And treating the AUD might not fix the underlying depression that often fuels the drinking or makes staying sober so hard.
So there's this huge need, really, for something new. Integrated approaches that can handle both at once.
Absolutely. The current options often struggle with this intertwined problem. We need strategies that look at the whole picture, not just isolated symptoms.
Which brings us right to this study. They really went for it in terms of design, what many would call the gold standard.
Definitely.
Their goal was comparing different combinations, ketamine plus naltrexone, ketamine plus saline, and then a control group getting Zolom, that's mesolam, plus saline.
Exactly. It was a 3-arm, randomized, double-blind, parallel group clinical trial. Quite a mouthful.
Yeah. Break that down for us.
Sure. Randomized just means people were assigned to groups by chance, like a coin toss.
Yeah.
Totally fair. Avoids bias.
Oh.
Double-blind is crucial. Neither the patients nor the researchers giving the treatment knew who got what. Ketamine, midazolam, naltrexone, saline. Nobody knew their specific mix. This stops expectations from influencing results.
Makes sense. And parallel group.
Just means once you were in a group, you stayed in that group for the whole study.
Yeah.
So ketamine, naltrexone people stayed ketamine, naltrexone people.
Got it. So a really rigorous setup. We can trust the findings more because of it.
Very much so.
So who were the people in the study?
Okay. They enrolled 65 adults, aged 21 to 65. And importantly, every single one had both current MDD with a specific score, MADRs 20 or higher, indicating moderate to severe depression.
Right.
And also current AUD. They met criteria for heavy drinking, meaning at least 4 heavy drinking days in the month just before they joined the study.
Okay, so people really struggling with both conditions actively.
Precisely. Then they were split into those 3 groups we mentioned.
Let's walk through those again.
Okay, first, the ketamine naltrexone group. So they got ketamine infusions. But importantly, they also got an injection of naltrexone that's an opioid blocker a day or 2 before the first ketamine dose, and they kept getting it throughout.
Okay, naltrexone plus ketamine, group 1.
Group 2 was ketamine saline. Same ketamine infusions, but instead of naltrexone, they got a saline injection, basically salt water, a placebo.
Ketamine alone, essentially.
Functionally, yes, compared to the active naltrexone.
Right.
And group 3, the control. Midazolam, saline, they got infusions of midazolam, that sedative.
That's lame.
Right. It's often used as a comparison because it can cause some similar feelings initially, like mild dissociation, maybe drowsiness. And they also got the saline placebo injection.
Okay, 3 distinct arms. And the treatment itself, how did that work?
It was quite structured. 4 weekly intravenous infusions, so day 7, day 14, and day 21.
Okay.
All done by expert staff in a specialized unit.
Yeah.
Very controlled dosing, close monitoring. Safety was a huge priority. Patients were watched closely during and after, and definitely no driving on infusion days.
Makes sense.
And interestingly, they allowed people to continue some of their standard meds, like antidepressants, maybe sleep aids. This makes it more like the real world.
Mm.
But crucially, no benzodiazepines like Xanax or Valium, and no opioids, because those could mess with the results.
Right, they'd interfere.
Yeah. And they did checks before each session, urine tests, breathalyzers to make sure no outside substances or alcohol were present. Very thorough.
All right, so now the results. This is where it gets really interesting, especially for depression. What did they find?
Well, here's the first surprise. All 3 groups, and I mean all 3, including the midazolam control group, showed significant improvement in depression scores.
Even the control.
Even the control. Actually, over 80% of participants across all groups reached depression remission. That's a MADR score below 10 by the end of the 4 weeks.
Wow, that is unexpected for the midazolam group. What does that suggest?
It really highlights the power of just being in a trial. The regular contact, the monitoring, the sense of hope, sometimes called the placebo effect, or maybe better, the contextual effect of care. It can be powerful.
Okay. But that wasn't the whole story for ketamine, was it?
Not at all. While those initial improvements during treatment looked similar, the lasting effects was different. The antidepressant effects held on significantly longer in both ketamine groups, the one with naltrexone and the one with saline, compared to the midazolam group.
Ah, so ketamine's benefit was more durable?
Exactly, especially when they checked a week after the last infusion. That sustained benefit is really where ketamine stood out from the active placebo.
Okay, that's a key difference. Now, what about that naltrexone, the opioid blocker? Did adding that change ketamine's effect on depression?
This is probably one of the most fascinating parts. For depression outcomes, there was no significant difference between the ketamine naltrexone group and the ketamine saline group.
Wait, really? So blocking opioid receptors didn't stop ketamine from working on depression here?
It didn't seem to, not significantly. This is really important because there's been this ongoing debate, this hypothesis, that maybe ketamine's antidepressant effects involve the opioid system somehow.
Right, I've heard that.
So the thinking was, if you block opioid receptors with naltrexone, you should reduce or maybe even block ketamine's mood benefit. But that's not what they found here, in this specific group of patients with both MDD and AUD.
So what does that point to?
It strongly suggests that, at least for these patients, ketamine's antidepressant action isn't primarily driven by stimulating opioid receptors. We probably need to focus more on other mechanisms we know ketamine affects, like the glutamate system, the brain's main excitatory neurotransmitter.
Okay, so a really significant finding for understanding how ketamine works, especially in this complex population.
Definitely challenges some assumptions.
So ketamine showed lasting antidepressant effects, potentially not via the opioid pathway here. But what about the alcohol side? Did it help reduce drinking or craving?
Yeah, this is where the results diverge quite a bit from the depression findings. When they looked at rates of complete abstinence from alcohol or staying free from heavy drinking days, there were no significant differences between the 3 groups. Ketamine naltrexone, ketamine saline, midazolam saline, they all performed similarly on those measures.
So no clear winner there for stopping or reducing drinking itself?
Not in this study, no. And it was similar for alcohol craving. While craving did decrease from the start across all 3 groups, which is good,
Right.
there wasn't a statistically significant difference between the groups in how much craving was reduced.
Okay, so if we're just looking at the direct alcohol use outcomes, drinking less, craving less ketamine didn't show a clear advantage over the midazolam control in this trial.
That seems to be the conclusion from these specific results. It suggests that while fixing the depression is crucial, it didn't automatically lead to a superior effect on the drinking behavior or craving compared to the active control, at least within the time frame and design of the study.
It's interesting. It really shows how complex AUD is, even when you treat the co-occurring depression effectively.
It absolutely does. They're intertwined, but maybe require slightly different angles of attack.
But the story doesn't quite end there because they looked beyond just depression scores and drinking habits, right?
What about anxiety and quality of life?
Yes, and this is another area where ketamine really shone. Both ketamine groups with or without naltrexone showed greater improvement in anxiety compared to the midazolam saline group.
Ah, okay. So a definite benefit for anxiety with ketamine.
Yes. And here's another fascinating twist. The group getting ketamine
Correct.
plus naltrexone actually showed greater anxiety reduction than the group getting just ketamine and saline.
Whoa, okay, so naltrexone didn't seem to affect the main depression outcome with ketamine, but it did seem to add an extra benefit specifically for anxiety when combined with ketamine. That's what the data suggests. It hints that naltrexone might have its own beneficial effect on anxiety pathways in these patients, maybe related to stress or reward systems that complements ketamine's effects. It's a really intriguing finding.
That is interesting. A potential specific role for that combination therapy for anxiety.
Oh.
What about overall quality of life?
Similar positive story there. Both ketamine groups also reported greater improvements in overall quality of life compared to the midazolam saline group.
That's huge because it's not just about symptoms, it's about actually feeling better in your day-to-day life.
Exactly. It's about function, enjoyment, overall well-being. So ketamine seemed to provide a broader benefit beyond just lifting the depression, impacting anxiety, and how people felt about their lives more generally.
Okay, that's a really important dimension. Now, quickly, what about safety? Any major concerns pop up?
Good news on that front. The study reported no serious adverse events linked to the study drugs. That's very reassuring.
Definitely. Any common side effects?
There were some common ones reported, things like tiredness, maybe some anxiety around the infusion itself, headache, drowsiness. But here's something really striking.
Yeah.
All 6 of the most common side effects reported actually occurred in the midazolam saline group, the control group.
Get out. Really? The control group had the most common side effects.
That's what they found. And most adverse events across all groups were rated mild to moderate. So overall, it supports the view that ketamine, given this way by experts, is generally well tolerated, maybe even more so than the active placebo used here in Sognespex.
That's quite remarkable. Okay, so let's try and pull this all together. It's a pretty nuanced picture, isn't it?
Very nuanced, but I agree, ultimately hopeful.
We saw all groups get some initial depression relief, maybe thanks to the trial setting itself.
The contextual effects.
But the ketamine groups had depression relief that lasted longer. And crucially, ketamine led to significantly better outcomes for anxiety and overall quality of life compared to the midazolam control.
Right. And the naltrexone piece is key. Finding it didn't block the main antidepressant effect really challenges that opioid mechanism theory, at least in this dual diagnosis context, pushes us towards other explanations, like glutamate.
But then, that extra benefit for anxiety when naltrexone was added to ketamine, that's really suggestive, isn't it? It hints at the potential for combining therapies in a very targeted way.
Absolutely. It raises that question. How do we use these finer details to create better, more precise strategies? Maybe one drug tackles mood duration, another specifically hits anxiety.
Tailoring the treatment.
Exactly. It suggests that a simple one-size-fits-all approach probably isn't the answer for something this complex. Different parts of the treatment might target different facets of the illness.
So while ketamine didn't directly beat the control on reducing alcohol use in this specific study, its impact on lasting mood improvement, anxiety, and quality of life offers real hope, especially for a group of people who often struggle to find things that work.
It emphasizes ketamine's potential for providing more comprehensive relief, even if the direct effect on drinking needs more investigation or perhaps different combination strategies.
It's been quite a journey through this research today. We've seen ketamine offering lasting mood benefits, significant anxiety reduction, and that quality of life boost for people dealing with both MDD and AUD. And that subtle but potentially important role for naltrexone may be boosting the anxiety relief specifically.
That's fascinating.
It really points towards the future, doesn't it? Thinking about multifaceted treatments.
It really does. Which leads to that final thought, that provocative question for you, the listener. Given these findings where different drug combinations seem to hit different targets, lasting mood versus anxiety, for example, how should we rethink treatment? Could we design therapies combining multiple agents, really tailored to an individual's specific mix of symptoms?
You know, moving even further beyond that one-size-fits-all approach to truly craft personalized plans. Exactly. Could that be the key to finally untangling that complex knot of depression and alcohol use disorder for more people? Something to think about.
A critical question for the field moving forward. Understanding these nuances could unlock much more effective care.
Keep asking questions, everyone. Stay curious, and always, always talk to your own healthcare provider for advice specific to you.
Absolutely.
And our sincere thanks to Yoon, John H. Crystal, and all their colleagues for this really valuable research. It adds so much to our understanding.